Good morning. My name is Brittain. I'm a patient representative for the National Joint Registry Board and a member of some of its subcommittees and working groups. The NJR annual report of 2021 included a section on the impact of COVID on joint replacement surgery volumes and waiting times. Research highlighted a substantial deficit in the provision of joint replacement surgery in 2020 after the pandemic started compared to 2019. The number of procedures performed in England, Wales and Northern Ireland fell by about half. This year's report includes research looking further at the impact with recovery of surgical volume levels. The independent sector has picked up the burden of the majority of surgery. NHS surgery activity levels have not fully recovered, with the numbers of procedures still below pre-COVID levels. Returning to pre-pandemic levels will not tackle the backlog, and even with an expansion of procedures undertaken, this could take many years, if not decades. Waiting times are nothing new, and they were rising pre-COVID. The pandemic just exacerbated them, with all but the most urgent of operations being cancelled and paused to free up capacity for those with COVID and related staff redeployment, staff sickness and hospital COVID infections. So what about the patients? What matters to patients is the time they have to wait for surgery and the negative consequences if their condition worsens, and the impact of their ability to carry out day-to-day activities. Post-pandemic, people are still waiting. For them, nothing's changed. Only infection rates, policies and practices around COVID. While people wait for surgery, their condition can become more debilitating with increased pain and loss of function, with stiffness and reduced range of movement and mobility. There can be an impact on mental health and well-being, and there can be additional issues such as sleep deprivation and fatigue related to physical and mental anguish, including pain, aches, and also from medication. Delayed surgery can have consequences, including risks and complications of other health issues and comorbidities developing, further deterioration and damage to joints, risk of surgical complications such as the health and surgical challenges, and issues post-surgery with slow or impeded recovery through loss of function of surrounding tissue, muscles and ligaments. This leads to a higher risk of poorer outcomes. People waiting for surgery can feel abandoned and forgotten with lack of communication when their procedure might take place. Brenda, waiting for a double hip replacement, said, "I've been told I'm definitely still on the waiting list for surgery, but they can't give me any indication of the timeline. They just leave you hanging, thinking, what am I going to do with my life?" As Rob waiting for a double knee replacement, they could have given a phone call or an update, but it went completely silent. It is almost like, is this going to happen? Isn't it going to happen? You were left in the lurch. They could have helped by being in contact with people. If I had the odd phone call just to say, look, we know you're waiting for an operation, but you have not been forgotten. This is the latest update. It would have been nice. It went so silent. People have felt being left and forgotten about with a lack of support to help manage day-to-day living with pain, mobility, fatigue, mental ill health and well-being, general care and finance. There is a need for support packages and for these to be personalised, such as with physiotherapy, occupational health and counselling. Some people are apprehensive and anxious about the risk of undergoing surgery and contracting COVID. Those identified as being extremely clinically vulnerable due to health conditions or treatments have a higher risk of COVID-related complications developing. It's been reported that people have been waiting 3 or more years for surgery. Despair over waiting and desperation for a better quality of life has led people looking beyond the NHS for surgery. This goes beyond the private sector in the UK, with some choosing to travel abroad, where their operations can be significantly less costly than in the UK. Kath, who sold her house to pay for a knee replacement in Lithuania, said, "People think that if you're doing this, you've got a wonderful pension, you're very well off. But the driver here is that people are in pain. This is not medical tourism, it's medical desperation." Sue, who was told there was a 5-year waiting list to use crowdfunding to pay for a knee replacement in Lithuania, she said the pain was through the roof. On a scale of between 1 and 10, it was 15. Figures from the Private Healthcare Information Network reveal, when comparing the period from July to September of 2019, the same period in 2021, an increase for self-funded hip replacements was by 165%, and for self-funded knee replacements by 122%. Although clinics and hospitals abroad can offer excellent care, this may not always be the case, which is a quality over cost consideration. Many countries don't have an NJR supporting the highest standards in safety and outcomes. The pandemic has exacerbated health inequalities, with those who can afford to pay for surgery and those who can't, impacting their quality of life. The COVID pandemic and its disruption of surgical activity has had a significant impact on patients and their quality of life while waiting for joint replacement surgery. Waiting lists have surgery, and will this lead to a meaningful reduction in waiting times? The NJR is not a regulatory or campaigning organisation. As an organisation collecting and using data to improve joint surgery safety and outcomes, it includes statistics relating to surgical volumes, which can be used by others for research, campaign on the issues people face when waiting for joint replacement surgery. For example, the research as mentioned in this year's report identifies nearly 9 months of joint replacement surgery having been lost, or around 160,000 fewer operations since the start of the pandemic.